I'm your Mountains of Hope chair and super excited about our meeting. November is a very busy month for cancer awareness, and today is World Pancreatic Cancer Awareness Day. So many of us have donned our purple. Several of us were also thinking, now we got to find something white because it's also Lung Cancer Awareness Month. And in West Virginia, lung cancer is the #1 cancer killer. So that is something we are very cognizant of as well. I was able to find my old white button from our white button pledge that AIM 14 did several years ago. So I was excited about digging that out and putting it to use again. This month is also Hospice and Palliative Care Awareness Month. And for those of us that work with treatment and quality of life, you know, hospice and palliative care, a partner with Mountains of Hope, has been absolutely fantastic. And we want to make sure to acknowledge that as well. And if that weren't enough to get November kicked off, it is also the American Cancer Society Great American Smokeout happens this month. And it's a wonderful excuse to have that one day to just try to quit. And every opportunity we have to try to quit smoking is an opportunity to prevent cancer and change a life. So we're incredibly excited to be able to participate that and roll that out to folks around the state as well. It's a little sad because this is our last membership meeting together before 2021. But it also gives us an opportunity to reflect, and it's always, to me, fitting that it follows right around Thanksgiving season, because it gives us an opportunity as a coalition to stop, reflect on the work that we've done, celebrate our accomplishments, and express our gratitude for those that are a part of what we do. And on that note, there were wonderful, grand plans to be able to express our gratitude in the works for this November meeting. But that was pre-COVID. So we've had to adapt and overcome. And instead of having the wonderful gathering of volunteers from all of our partnership groups and all of our volunteers out in the community, we are making do this year with doing a virtual thank you. We did ask for people to submit pictures and photos of work that they were doing out in the community. So we have some of those to share with you a little later on as a slideshow. But, you know, our volunteers are the heart of our coalition work. They are the people that take the information that we give and go out into the community. Every partner organization that makes up our coalition has committed time and effort and helps make those networks happen. And we really take this moment to say thank you and that we appreciate that. I don't have to explain to most of you how vital it is to have volunteers that work with you to battle cancer in the community. Most of you understand that. What I think I do need to say, and that's very important, is that each and every one of you that has taken the effort today to be a part of Mountains of Hope, both today, in the past, and in the future, you're a volunteer too. You know, you're volunteering to be a part of our work here at the coalition. And if we don't say it enough, please know, thank you. We appreciate the work that you're doing here. Whether you're providing some feedback on something we've sent you and it's in an advisory capacity, whether you're working with us through the subcommittees and the work groups to see out the aims and goals of the cancer plan, whether you were taking on a leadership role and stepping up to help provide the infrastructure necessary for us to do this type of work. That is an important piece of what we do, and we really thank you for making that a priority in your life. We'll get to hear today from some of our mini grant recipients. So they are the volunteers that are taking some of the resources that we have here at Mountains of Hope and putting those plans into action. I'm excited to hear back about what they were able to do over this past year. And it gives us an opportunity to renew our commitment as Mountains of Hope to provide verified information, data-driven interventions and resources to make those available to our volunteers. And whether that is through working on the cancer plan, the training and leadership pieces that we have, such as today, you know, you guys filled out surveys and told us, we want to know, how do we engage in policymaking? How do we do that? How do we do that effectively? And so we were able to reach out into the network and bring you a wonderful educational piece today with Dan. And we're looking forward to that as well. So that is a little bit of a thank you, taking a virtual stance this year. Hopefully in the future, we will make plans to be able to gather together and actually celebrate face to face and let you know that we appreciate all that you do. And before I turn it over, I have one more exciting announcement. And this is one we've been waiting for a while. So after 2 years of development, the 2021-2025 Cancer Plan has now been approved through the Cancer Plan Committee, the Steering Committee, the Bureau for Public Health. And following today's membership meeting, there's going to be an email. An electronic version is going to go out on the MOH member listserv. If you're not a part of the listserv, please put in the chat, add me to the listserv and your email address so that we can do that. An electronic version will go out. So this is where you have homework, because our future efforts along the cancer plan are going to be printing the cancer plan, making an online version of it available once it goes through accessibility, because we want it to be able to work on screen readers and things like that. So we still have that piece to do. And then we're going to do a formal rollout of the cancer plan at our January 21st meeting. So that's going to be really exciting. But your homework is to review the cancer plan, look at it, get familiar with it. There's been a redesign so that this is a useful and valuable product. And then as you're looking at it, think of the people that you interact with in your networks, your social networks, your volunteer groups that can use this resource, and then let us know how it's best to get it to them. We're looking at trying to do an order form so people can order a printed copy. We want to have a version online. So if it's valuable to you for us to send you a bit.ly link that you can share through email, can we put that link on social media? Is there a good place to share it there? Let us know, because getting that piece of information out into the world is very important. And so you guys are fine listening to me, but we have much more important people to listen to today. So without further ado, Craig, if you would introduce our first guest speaker.
Absolutely, and thank you for that fantastic beginning there, Shelly. Good morning to all. So for those who may not know me, my name is Craig Bromley from the Bureau for Public Health and serving as the West Virginia Comprehensive Cancer Program Director. And it is my pleasure to welcome and introduce from the National Comprehensive Cancer Control Program, the CDC consultant, Mary Boyd.
Thank you, Craig. Today I am going to present to you briefly on a few talking points regarding the NCCC program priorities. So without further ado, I'm going to share my screen. I appreciate the opportunity. Wait, let me go back for a second. Sometimes this works better if I take my camera off. Stop the share for a minute. Okay. Let me try this again. I'm sorry. Can you guys see my screen yet?
Yeah, we can see your screen. We can't quite hear you very well.
Okay, I'll speak up. Can you see the PowerPoint?
Yes, we can. Yeah, now it's in presenter mode.
Oops. Okay, thank you again for allowing me the opportunity to speak. Thank you to Craig, the West Virginia Comprehensive Cancer Control Program, and the MOH Coalition. So today I will be addressing cancer control through the impact of the COVID-19 pandemic and a dual approach to health equity. A few things we're going to discuss is the history of the National Comprehensive Cancer Control Program, COVID-19 pandemic and its impact on our cancer programs in CDC, and selecting evidence-based interventions using the dual approach for health equity. As you can see from this slide, the Comprehensive Cancer Control Program has been in effect since 1998. So we've been in effect for 22 years. We started in 1998 as a pilot project, and we supported 6 programs to create a comprehensive cancer control plan. By 2005, we funded all 50 states and the District of Columbia. And by 2010, we established 6 priorities. And currently, no, in 2017, CDC funded its 4th iteration of our 5-year funding cycle, which is DP 1701, the program and the grant cycle that you are in at this time. And currently, we still fund 50 states in the District of Columbia, in addition to 7 US territories and 8 tribal programs. And you guys are tasked with assessing the burden of cancer, priorities, and implementing cancer control action plans and strategies and initiatives. Quickly, just a picture of our organizational chart. Office of the Director houses our director, Dr. Lisa Richardson. And within the Office of the Director, we have 4 branches, 3 of which are the components of the 1701 program. Comprehensive Cancer Control is the second component. In comp cancer, we offer a 3-tier approach to program management. And in saying that, I mean that we have a program consultant, myself, we have an evaluation subject matter expert, and we also have a scientific expert. And this was structured to provide a more comprehensive coverage and utilize the expertise of our SMEs more effectively to provide the best possible TA for our programs. The ultimate goal for the Comp Cancer branch is to make all people free of cancer. And within that, we have 3 overarching objectives. We have primary prevention, screening, and cancer survivorship. Those 3 are actually trimmed down from the original 6 priorities adopted in 2010, but they're still inclusive enough to allow for the cross-cutting methods that will identify and support health equity strategies. As you can see, the guiding principles are health equity strategies, beginning with the end in mind, meaning knowing exactly what it is you're trying to measure and what you would like to accomplish, collaboration, and targeted communications. In addition, the strengths in order to implement those specific activities and interventions would be data collection, translation, and evaluation to see exactly what worked well and what didn't, and also partnerships and collaborations, such as the Mountains of Hope Coalition. The impact across our programs. First, I'd like to show you a map. This map was actually taken from the CDC website, and last night I updated some of the data because the data seems to change daily. Initially, when I pulled this map, West Virginia was shaded a little bit lighter than what it is now. Right now, West Virginia is a little more blue, and the cases per 100,000 in the last 7 days total 47.1. Cases in the last 7 days are now 6,008. Total cases 35,324. Cases per 100,000, 1,956, and the number of deaths total 33. And down at the bottom, if you see those square boxes and then the buttons below, it kind of gives you the range of where West Virginia lies. And West Virginia lies somewhat in the middle of total cases of COVID. In addition, I also pulled a West Virginia map, and it also showed that there were 3 counties that experienced the highest COVID cases. It was Cable, West Virginia, and they reported over 2,000 cases, and they account for about 57% of your state cases with 44 deaths. Logan, West Virginia, 24.6%, or 901 cases. and then Greenbrier, and that totaled 8.1%. I couldn't transfer the map over, but if you go onto the CDC website, there's a way to go into the main page, and then you can trickle down into the maps to show you the data for your specific state. The impact on COVID impacted states in that states and cities were shut down in full shutdown mode during the initial stages of the pandemic. The hospitals canceled elective procedures and surgeries as COVID became a priority. The beds were needed for COVID patients, and patients who had procedures that were elective were postponed. The general public was also hesitant and nervous or anxious, and they also delayed screening appointments or visiting any healthcare facility for fear of exposure to the virus. Healthcare personnel on the front lines also were at a higher risk for exposure to the virus, and also the possibility of exposing to their family. A couple of weeks ago, our director, Dr. Lisa Richardson, spoke at a conference or a webinar, and she reported that the spread of the pandemic directly affected our programs as well. She mentioned that during the crisis, surgeries experienced the biggest drop since many hospitals were not performing elective surgeries or procedures. They were full to capacity, and the primary need was to fill the beds with COVID patients. These missed opportunities ultimately drives up the cost of care, with more cancers being detected at later stages. In addition, she also mentioned that she felt that this pandemic would result in a long-term after effects, as we may not witness these implications until the next 10 years or so, resulting in more severe cases diagnosed at later stages. So unfortunately, cancer can't wait. Even though we're in a pandemic right now, we still have to be mindful and try to make sure that those patients are served and they're still coming out to get their necessary treatments. The impact on the DCPC programs was similar to the state and local health departments. Our state health department staff were reassigned to perform COVID duties. Less time was spent for CDC commitments and duties, or the expectations of continued operations, meaning some programs had to work double duty. Finding a balance between work and home obligations, lack of childcare can lead to stress because you're trying to juggle so many hats and so many balls in the air. Less implementation of action plan activities. A lot of programs reported having to put contracts on hold. That left them with a lot of money left over and the need to try to transfer the money over either through carryover or extended authority that was projected for the end of the year. Partners who collaborated were either closed or limited due to stay-at-home ordinances, so procedures were missed for the population they served. Also resulted in delayed or missed CDC deliverables, such as the federal financial report, which was due the end of September, in addition to the leadership plans, missed coalition meetings. But with the CDC deliverables, we tried to be as flexible as possible, and we did grant some extensions to certain states. States that needed the extensions, everyone's extension was granted. So we did, understand that there were circumstances that caused people from not being able to meet those deliverables. Impact at CDC was similar. CDC staff were reassigned to perform COVID-19 duties. They were long hours and weekends. I was also assigned for 60 days to a specific task force, and we worked weekends. Pretty much everyone worked weekends. There were not a lot of breaks. It resulted in a lot of burnout. The shifting of duties required us to wear many hats as well. In our division and in the branch, the division of chronic disease, there was actually about 30% of the employees out working on COVID detail. And in our specific branch, we had about 50% of the branch rolling in and out. A lot were positions of leadership, so we had to kind of shift around, and people were working double duty, or there was just no leadership in place at the time. Also, some positions at CDC do require in-house, such as the scientists in the lab or at the Emergency Operations Center. So that puts them at an extra risk of COVID. Repeated requests for staff based on expertise. Similarly, a lot of the deployments wanted to request the same people over and over because they can hit the ground running and they would not have to waste time training them, which would take away from resources where we needed to just move forward and start whatever the assignment was. So a lot of people got burnt out that way. In addition to the same difficulty in home life and work balance, no childcare, trying to tend to the children's needs as well as working simultaneously. So a few recommendations, of course, continue taking the precautions identified by CDC and public health officials, social distancing, avoiding crowds, hand washing. Also on the work front, continue to provide any type of telework options that you can. Allow only essential employees in the workplace, ensure the safety of the patients and the clinical staff with limited appointments or even limited staff present, telehealth visits, phone visits, thoroughly disinfecting methods for each patient, more testing to ensure easy and quick access to treatment. And also on a personal note, just take time to really check on family members and people who may not have the same type of support systems that you have, and also take time individually to relax and participate in activities, exercise and walking, anything that you would enjoy to kind of take your mind off of the COVID pandemic at this point. To health equity. So equality versus health equity, there's a difference. Equality is providing the same level of opportunity for everyone. As you can see in the picture, the box with equality has everyone with the same size box. In equity, we have to provide various levels of support and assistance depending on the specific needs or abilities of a population or group or community. And in the health equity picture, we have 3 people of 3 different sizes, and they also have been accommodated with 3 different boxes or additional boxes in order for them to, quote unquote, reach the fruit. Again, health equity is achieved when everyone has the opportunity to live their healthiest life, including people in communities with a higher burden of cancer. And we do that through programs, successful health equity strategies, measuring data practices to support the advancement of health equity, policy, laws, regulations, and rules to improve population health. That could be anything from more smoking laws and also trying to target specific populations that find that are being stricken with higher lung cancer levels. Why health equity? Basically, we focus on health equity to address power imbalances, social and political hierarchies, norms and values, because those 3 things, in addition to several others, can perpetuate racism, discrimination, and exclusion. And without health equity in place, these imbalances can make it difficult for people to live healthier lives. The dual approach. So this is an example of the dual approach, and it's an inclusive strategy that meets people where they are in our action plans. Social determinants of health are key indicators and conditions that actually illustrate why some are not being reached or have limited access to care. Conditions in the environment, where people live, work, or play also play a part in providing barriers to being able to live at optimum levels of health. And the dual approach provides specific culturally tailored interventions for priority populations or subgroups. As you can see in the picture, the population-wide intervention is just a picture of the population. And then the second picture actually shows the culturally tailored intervention to reach that specific priority population. And the final picture shows the dual approach, which encompasses everyone receiving those specific services. Maybe not exactly with the same type of approach, but just the fact that everyone is receiving those healthcare services is is basically the goal. And in our action plans, the expectation is for programs to provide at least one population-wide evidence-based strategy. The three, as you can see, the three priorities have been whittled down from 6, like I mentioned before: primary prevention of cancer, early detection and treatment of cancer, and improving quality of life for survivors. So the population-wide strategy is one intervention. And then you need to have also a second strategy with the health equity focus. Now, bear in mind, some programs do have more than one primary prevention, more than one early detection, and more than one survivorship strategy. However, the requirement for CDC is still to have only one health equity focus. So you can have a primary prevention strategy that includes tobacco cessation and maybe HPV prevention. However, you only need one health equity EBI. So that would be up to the program and the state and the coalition to determine which one would get us the most bang for our buck, which health equity would make the biggest impact, which population, has the biggest need. So that would be something that would be determined by data and just a discussion among you guys as a group. So again, a lot of states have gotten confused by this. CDC made this change because initially we felt like a lot of programs were trying to do too much with too little, and we wanted to whittle it down a little bit so that they could concentrate their efforts on the things that were working best for their program. And also we're at the almost at the end of the 5-year grant cycle. So when you really think about it, as we move into the next cycle, we have to make sure that states are really progressing and showing the impact that they've made with this comp cancer funding, so that as we move forward, and then we also have to worry about Congress and appropriation. So we really need to show what type of impact states are making in cancer control. Finally, I pulled a few examples from the state cancer plan with West Virginia. This first one shows a primary prevention strategy with a tobacco use risk factor, and it's environmental, and it's the multi-component intervention to increase tobacco use. And it's the same strategy under health equity. However, there's a target of a different population. And in the action plan, I don't remember the page, but the objective is to reduce the use of tobacco products and electronic nicotine delivery systems among the LGBTQ adults. And then it drills down further to a specific population of young adults from 18 to 34. So in this instance, the hard to reach population is obviously the LGBTQ, and then the smaller target are the 18 to 34-year-olds. So the questions you would ask yourself, and I'm sure these were asked as you were completing this action plan, is how did the program arrive at this? Obviously through data and surveillance. You plan to use external partners such as Dr. Scout. I know he is a well-known subject matter expert in the LGBT community, and just want to make sure that you adapt the program to whatever target audience you're going to meet, get a sense of the population, how to reach those pockets in order to be effective. What else would you do? Is it evidence-based? Has it been found in LIDS? And yes, this is one of our LIDS components. LIDS is the Library of Data Indicators that we use at CDC, and we recommend that programs use to pull from to provide their evidence-based interventions and use those accordingly. You need to also find out if your intervention is culturally appropriate to fit to the audience. Will the message resonate properly? Whether it's demographically, geographically, or culturally, you have to decide the difference. Not just selecting interventions that provide the lowest hanging fruit, because like I mentioned before, they are really going to start, looking at these programs. The second slide is also using the dual approach with early detection for colorectal cancer screening. And this intervention strategy is a community clinical linkage. In this particular strategy, West Virginia is looking at the percentage of uninsured adults aged 50 to 74 years who are up to date on recommended screening for colorectal cancer. The target population is, of course, population-wide, and then the health equity piece is going to focus on uninsured individuals. So again, West Virginia will target specific interventions that would create better access for those people in underserved regions or uninsured people. It could even be rural, geographical, or cultural. And it's just interesting to note that West Virginia was one of our first programs back in, I believe, 2018 that signed that pledge for colorectal cancer. So just to commend you for that. I know you guys are doing great work in trying to target and meet colorectal cancer screening and colorectal cancer treatment initiatives, in addition to participating in the STEM project, the state engagement model. So just wanted to definitely put those kudos out to West Virginia on the great work that you're doing in the state. And finally, I just listed a few resources that I thought would be helpful if you wanted to explore further. I know this was very brief, but just wanted to touch on a few things that Craig wanted me to discuss. But if you wanted to go and look more about health equity, social determinants of health, cancer.gov under NIH, and also under what CDC is doing for coronavirus. There you can find the maps and the guides to kind of give you a kind of, how do you say, firsthand, it's updated regularly, so it will be kind of in real time. And then, of course, our cancer information channel. And then this link is to an article that was sent to us recently by Dr. Lisa Richardson, and it also touched on COVID strategies and science. And then the last link is people versus cancer COVID, and that is the link where you can see the talk that Lisa Richardson gave. And just to note, when you go into this link, there's a long 20-minute pause, so don't think that your screen or your computer's not working. It's just that for some reason it pauses for about 20 to 21 minutes. So if you scroll through to 20 minutes and beyond, you'll see Dr. Richardson speak. She's the first one to speak. But other than that, that's what I have. And thank you again to the program for allowing me this opportunity to speak. I look forward to hearing everything else throughout the day with this conference. And if you have any questions, if we have time, I guess I'll take them at this time. And thank you so much.
Thank you, Mary. We do. Go ahead, Summer.
I was going to say, thank you so much, Mary Boyd. We're thrilled to have you on this call in this meeting. And so we do have a couple of questions. Mary Ellen, would you like to unmute yourself and ask your question?
Hi, Mary. I'm Mary Ellen Kahn. I'm the program director for state CDC-funded colorectal program.
Okay.
So being that, West Virginia, we're very rural here. And oftentimes, we see that in some counties, there is an inequity because there just really is not the access to cancer control programs, for prevention, early detection screening programs, as well as even treatment for cancer patients. And so, in terms of with the population-wide interventions, any suggestions that, besides looking at data, because we do try to target a lot of our work to, those areas with high rates of late-stage diagnosis. But given, some of these issues that really are, due to infrastructure and lack of access, any suggestions on how to prioritize, doing the work for population-based interventions?
Okay, let me make sure I understand the question. So basically what you're saying is because you are in a rural state at times, and I've gotten this from a couple of states as well, and the population is already at a disadvantage from what you're saying. You
Yes.
wanted to know, how do you prioritize the data or the lack thereof in order to create these interventions? Is that correct?
Yeah, just really,
Or
helping, suggestions on how to, because there are so many groups in need, in terms of really strategizing, and prioritizing.
Yeah, see, that would be something that as a group, you would have to kind of decide which group is really in the most need. And unfortunately, data does come into play. That's one of our big requirements that we stress, the use of data. I would suggest getting with your national registry program to help them kind of whittle down the data and find out exactly where those pockets are with the biggest need and the most, the most disparate, who have higher rates of cancer or higher deaths of cancer. I know for a fact that the Appalachia population is a huge population that experiences lots of cancer cases and cancer deaths. So unfortunately, it would have to be data driven. I would say to, between your NPCR program, this colorectal program, and even COP cancer, I would be willing to work with those three to help you try to come up with ways to really hone in on who you should target. So that would be something that I can take back to my colleagues at Breast and Cervical, at NPCR.
Thank you. Yeah, because you mentioned Appalachia.
Really target. Right.
The state is where all 55 counties in the state fall within Appalachia. And just to give you an example, when I said, we look at data, we really try to target our efforts on counties that have high rates of late stage colorectal cancer diagnosis. An indication there's just really not a lot of screening going on. And if is Patty Davis on this meeting today? Because one of the counties that we're just now starting to work in is Hampshire County. And Patty is a community member from Hampshire, and she might be able to speak a little bit in terms of, what are some of the issues that they encounter there.
Good morning, Mary.
Good morning.
I was diagnosed with cancer in 1999. And having lived here in a rural area, my treatment had to be either in Cumberland, Maryland, which is 25 miles one way, Winchester, Virginia, which is, of course, 45 miles in the other direction, or travel all of the way to Morgantown. And I do live in the Eastern Panhandle. And this has been a problem forever, of course, in the rural areas. And I was very much interested in trying to help and make a change. So shortly after 1999, I became involved with Mountains of Hope. And later, totally volunteer. My whole time has been nothing but a volunteer. And I was honored and privileged to be chair of Mountains of Hope for a while. But it all starts grassroots back in your hometowns in these rural areas. And sometimes they're forgotten, but they need the most help. It's just like Bonnie's bus, when it started coming into our areas, I know within the Hampshire County, it was just a godsend for women. I received so many calls, and it's something small and simple, but it has saved lives here in Hampshire County. And colorectal, my mother right now is 94 years old, and she is a 48-year colon cancer survivor.
Oh, congratulations.
But of course, she was one of the ones that was caught early, and she chose to be in a program at West Virginia University Hospital at the time. So, and our numbers in Hampshire County are really, really high. And anytime that we can get involved with the program, it's just a win-win and a plus for all of us. And then,
Right.
One of
Well,
those
first of all,
things that-
congratulations on just being a survivor. But I'm sorry, were you saying something, Shelly?
Oh, go ahead.
Okay. Again, that would be, and it's unfortunate, and I truly feel your feel for you and your concerns about that. Patient navigation is one of the things that I know the colorectal cancer program and the breast and cervical program are really pushing as implementation methods and initiatives. I wonder what type of resources they have in that area. Again, that would be something that I would have to go back to those specific program directors to find out what is in the area and what can be done in the area. Also, I do like to encourage my programs, don't just rely on CDC. There's other opportunities out there. Anytime I see other grant opportunities, I forward it to my programs. There was recently an opportunity with the Robert Wood Johnson Foundation that offered a grant for rural health programs. If I can go back and find it, I can send it. I think I sent it out to the West Virginia team. But I would say, look and take advantage of other opportunities, local opportunities out there that offer any type of additional resources that would target rural areas. There's more than you know out there, and it's just a matter of being educated and finding those things. But again, you can go through your program consultant, because that's not something we would expect you to do. But as a coalition, be mindful of there might be other grant opportunities out there that you can target and research and possibly apply for. Even if it is just $10,000, it may be something that could help you in your efforts to reach those populations that are harder to reach or that are in smaller areas that provide any type of additional resources for you guys. I know with when I had Louisiana, they had a similar problem, and they had one of their coalition members actually applied for a local grant and received it. It was $10,000, but she created a system where she provided gas cards and things like that for programs to get, individuals that were in rural areas to get to treatment and screening that kind of remove some of those barriers. So you just never know what's out there. And I'm one that's always out there reaching and researching and looking to see if there's any additional resources for my states. So I'll be on the lookout for that as well. And I'll be in touch with Craig and the rest of the West Virginia team to see if there's something that we can do about helping you with that.
thank you, Mary.
You're welcome.
Thank you for that, Mary. I think as the coalition looks at the new cancer coming out, please keep in mind those things that Mary pointed out to us today about health equity and how we can reach our populations, who those populations are. We've got to identify who those 3 people are reaching for the fruit and look at what resources we can bring to the table so that we can stack those boxes up in the most efficient way possible. So I'm going to be looking for resources on that. We're running a little over time, so I'm going to move us along. But I do want to thank you, Mary, for being a part of things. We really appreciate it. We love having the opportunity to reach out to our national partners and find out what's happening in the big wide world outside of the mountains.
Definitely. And I'll put my email in the chat. So if you think of questions later after the fact, after the meeting, feel free to contact me. Okay.
That would be great. So next, we're going to talk a little bit about some of the things that are happening in the mountains. And Mountains of Hope provides many grants that go out to community volunteers and programs throughout the state to enact the West Virginia Cancer Plan. We're going to get to hear from 3 of our mini grant recipients over the past year. Our volunteer presenters, I just want to remind you, you have 5 minutes to tell us about your program, and I'm going to have you introduce yourselves, but we'll start with the mini grant from Marshall University.
Hi, can you hear me?
Yes.
Awesome. I'm Niccia Ditrapano. I'm one of the OBGYN residents at Marshall University, and I'm going to be sharing our project with you all. Let me just share my screen here. Okay, can you guys see the slideshow?
Yes.
Okay, perfect. All right, so this is our project. It's improving HPV vaccination awareness and series completion through pharmacy access. So the purpose is to improve provider awareness and utilization of prescribing the HPV vaccine through pharmacies and improving access for adolescents, and then to determine parent perception of the feasibility of pharmacy utilization for getting the vaccine.
Your slides are not progressing. It's stuck on background.
Oh no. Let me see.
Hit enable editing. That will allow it to advance.
Okay.
Up at the top there.
Yeah, that's not even in the view that I'm in. Let me see. Does that work?
There you go. You're in presenter view now and it's working.
Okay, perfect. Sorry about that. Okay, so just a little bit of background of why we're doing this. So in 2017 in West Virginia, 67.5% of females and 54% of males had received 1 dose of the HPV vaccine, and then only 48% of females and 39% of males had completed the series. So this is well below the healthy people target of 80% coverage. So we want to help try to improve those rates. So basically in our rural area, traveling to a healthcare provider can be a barrier to completing the vaccine series. Providing easier and closer access for vaccination may improve vaccination rates. And this is especially important given that West Virginia has significantly higher rates of HPV related disease relative to other states. So in 2018, legislation was passed which allows for pharmacies to provide HPV vaccines to patients ages 11 to 18 with a prescription from a healthcare provider. And in rural areas, pharmacies are typically more accessible to patients than their primary care provider's office. A lot of them travel a long way to go to their primary care offices, so accessing a pharmacy would be easier. So pharmacist administration of vaccines has been shown to significantly improve access to immunization with other vaccines in the past. So our goals were to identify which pharmacies in the surrounding West Virginia counties stock the HPV vaccine and compile a list for providers and patients. We surveyed and educated healthcare providers at Marshall Health about prescribing the HPV vaccine through pharmacies. And we surveyed parents of adolescents on their opinion of receiving the HPV vaccine through the pharmacy setting. So what we did was we held educational sessions of the practitioners, which included our OBGYN doctors, family medicine, and pediatric departments. And then we educated them on what all pharmacies were stocking the vaccine and how to prescribe it through our electronic medical record. We also did a paper survey and asked providers their experience with writing the HPV vaccine, how often they see adolescents, were they aware of this legislation allowing pharmacy access, how likely they were to use this option, and how likely they would in the future after our educational session. So we also did a 6-month follow-up and surveyed the same providers and asked if their prescription practices had changed following our session and wanted to know any barriers that they ran into, so we could potentially help improve that in the future. So our parent surveys, one of our inclusion criteria was that everyone had to be a West Virginia resident and a parent or guardian of an adolescent age 11 to 18. We recruited people who met these through informational booths set up at Marshall Health, in the waiting rooms before appointments. And this incentive was provided to the parents who completed the surveys. So the purpose was to further assess which patients might benefit the most from pharmacy access. And all parents were given safety and efficiency information about the vaccines. So these are just some of the things we asked. We asked what county they lived in, the age and gender of their adolescent children, if they had started the HPV series, if they completed it, and why not. If they were aware that they could get the HPV vaccine through a pharmacy, had they ever received other vaccines through a pharmacy. So here's some of our results. We had 71 providers who completed the initial survey. We had 45 who completed the follow-up. Only 22% of those providers were aware of the pharmacy access for HPV vaccination initially, and 64% were aware at 6 months. Most of the providers felt this pharmacy access would be beneficial for rural patients, and they said that they would be likely or very likely to prescribe the vaccine to adolescents through a pharmacy. However, at 6 months, only 2 of the providers had actually reported prescribing the vaccine this way. So even though they said they were likely to, we didn't see a big response of them actually prescribing it through pharmacies. So for the parent survey side, we had 121 parents complete the survey. And we found that the HPV vaccine completion was not affected by their rural county designation, but overall males were less likely to have completed the vaccine, which we know from other data. Rural parents did live closer to pharmacies than their primary care providers, and I'll show you a figure of that. That was one of the questions we asked, how many miles they lived away from a pharmacy or their primary care provider. Only 16 of the parents were aware of pharmacy access of the vaccine. And of the parents whose adolescents had started or completed the vaccine, the majority of those, 78%, felt that pharmacy access would be very beneficial to complete the series, or it would have been very beneficial had they known about it. So this is just a graph of the percentage of adolescents who had not started in the first green column, who had started or who had completed the HPV vaccine based on rural or urban county. So there wasn't a significant difference based on our urban and rural. As you can see, they're pretty close, the percentage that completed them. And then, like we said, more females had completed it than males. This shows a percentage of parents reporting distances to primary care providers where they typically receive vaccines, and then their distance from pharmacies in miles. So there were a lot more shorter distances for their miles to pharmacies. So miles to the primary care providers, we had a lot more that reported that they lived 10 to 20 miles from a provider, or 20 to 30 miles was significantly more than in this group. Only a few lived 20 to 30 miles from a pharmacy, and none lived more than 30 miles from a pharmacy, whereas some lived more than 30 miles from their primary care provider. So you could see where it could be beneficial to complete the series at a pharmacy. Let's see. Is that chat questions to me?
Not yet.
No, okay, perfect. So in conclusion, pharmacy vaccination is still underutilized. We didn't have that many providers who switched to prescribing it that way, but both parents and physicians have favorable views on using pharmacies for adolescent HPV vaccination series completion. So, of course, want to acknowledge Mountains of Hope, West Virginia Cancer Coalition, who funded our study. And that's it for my PowerPoint. I could answer any questions. Let me pull this back up.
Did you say, I'm sorry.
Sure, go ahead, Anna.
Did you say you had a map of all of West Virginia showing the pharmacies that offered the HPV vaccine?
We just put together a list, and yeah, basically we figured out that all Kroger, Walgreens, and then what used to be Rite Aid, now Walgreens Pharmacy, had them in stock. But we have a list that we gave to the providers and parents that showed specifically what pharmacies had them.
Did you have an issue? Did any privately owned pharmacies stock HPV vaccine? When I've called some in a different area of the state, none of them did, and some of them were a little offended that I even would ask. So
yeah, that was definitely, I didn't see any smaller private ones who had it. Yeah.
Was that an issue for any of the parents that, or did you get that?
None of them reported that, and none of the providers put that as a response to barriers they ran into. So I could see that, but now it seems like there's a big chain pharmacy pretty close to most people.
So I had a question. This is Susan. Did all the providers offer the vaccine in the office, or were there any that didn't offer it in the office?
Before,
right.
In general, all of those offer it in the office. Yeah.
It would be interesting to me to see if they would be willing to do the follow-up, you know, if they would write the prescription then and there for the follow-up to be at the pharmacy. That would be excellent.
Yeah, so the way we did it in our teaching session was the way we recommended was they could get their first vaccine in the office that day, so they were already there for their appointment. But then where we really fall off is people completing the series, coming back for their second or third vaccine. So then we recommended just going ahead and giving the prescription for the second and third dose that same day, because we figured that would help, but just not many people ended up doing that. But we're still working at it.
So I hope I don't butcher your name, Dr.
Ditrapano.
Ditrapano. Okay. So first of all, one, we want you to come back to Mountains of Hope because this is great formative research, and having your input on what type of resources that we can create to help address this need is something that we need from you. So we hope that you and your group will join us again. Secondly, we need more time because this is some really great interactions that were going on, but we do want to hear from our other
I'm sorry.
volunteers too. So
I
have to be the evil stepmother, which is a role I'm very comfortable with, and move us along. But please, we do want you to come back in and be a part of those HPV discussions. Okay. So next is the West Virginia Oral Health Coalition.
Hey, thanks everyone. Hey Sandra, I was so happy to see you. So happy to see so many familiar faces. Do you want me to share screen or is Lauren gonna bring those up?
If you can share your screen, that would be great.
Yep, give me just 1 second and I'll get right on that. There we go. Okay, so I understood I have 5 minutes, so I'll be as quick and succinct as possible. It's a pleasure to be here with you all this morning. Again, my name's Gina Sharps. I'm the coordinator with the West Virginia Oral Health Coalition, and I want to thank my colleague who's on the member, she's a member of the Mountains of Hope Coalition, and that's Jana Thornsberry, for encouraging me to join the meeting and talk a little bit about our outreach and our project. And I also, that was professional gratitude, but personal gratitude, I want to take a moment and thank the coalition for all you do in terms of cancer prevention, promotion, early detection. This time last year, I was leaving my surgeon's office to get the results of a routine colonoscopy and came out with the result with the diagnosis of stage 3 colorectal cancer. So I have spent the last year in clinical trials, chemotherapy, radiation, and I wore my, I don't know if you can see it, I'm gonna try to show it to you. I survived chemotherapy. I just finished up last month. So this presentation makes it a lot more meaningful, and this group is a lot more meaningful. And it was awesome to hear the CDC project officer talk about the importance of colorectal prevention and cancer screening in West Virginia. But I'm going to do a big switcheroo and talk a bit about our project. And it's called Tobacco or Health, Choose Health. We had 3 overarching objectives, and I'm going to talk very briefly about each one of them. And this was our first objective, and it was to facilitate one educational CE program focused on evidence-based tobacco cessation to approximately 50 members of our West Virginia Oral Health Coalition by March 2020. And if you've not had the opportunity to meet these 2 fantastic educators that you see on the screen, you're looking at Dr. Susan Morgan and Sue Ann Gatos, and both of them are from WVU School of Dentistry, and they were extremely instrumental in fulfilling our first objective of conducting our CE program. And again, the program was held in conjunction with our West Virginia Oral Health Summit in January of 2020. It was free to attend. We promoted it statewide to a whole host of interprofessional individuals. And again, the overarching objective was teaching providers evidence-based approaches for helping patients become tobacco-free. And we exceeded our objective. We targeted 50, we trained 71, and 30 were dental providers. I don't have the level of detail with the course evaluations, but they were outstanding. If you wanted to see them, I can send them on at a later time. So that was our objective 1. Objective 2, I just love this one. We did another continuing education program, this time working with our West Virginia Dental Hygienist Association. We targeted 50 members. We exceeded that, but this time in the picture on the right-hand side, you'll see a lot of young-looking folk, and these were students from our state's 3 dental hygiene schools that were able to be a part of this education. And there was some advocacy training with the American Cancer Society on juuling and current legislation. And this is, to me, this is such a win, because if you introduce legislative activities and the importance of advocacy to a student population when they are in private practice and we need them to help us advocate for something, no matter what the topic area, they're familiar with the process and they know how to get involved. They're not intimidated. So I would like to see this continue on. And again, I didn't know if I should include the data breakdown, but we have it on the course evaluations for that as well. And then last but not least, our third kind of target area was to partner with 10 school-based health centers with West Virginia Primary Care Association on promoting the Rethink Your Drink message. And if you're not familiar with Rethink Your Drink, 2 main pieces of it in terms of messaging: reduce sugary sweetened beverages and increase water consumption. This is a picture of what the kit looks like on the lower right-hand side. And let me look at my notes, because I wanted to tell you one other thing about, Rethink Your Drink. It's a nationwide social marketing campaign, aimed at introducing or initiating rather conversations around sugary sweetened beverages, which we all know is the single largest category of caloric intake in children. So that's extremely important when we look at the role of sugary sweetened beverages in obesity. So that's what we did with our mini grant. And I only have 5 minutes. I hope I covered everything. Oh, here's a little bit more of what's involved with the Rethink Your Drink kit. And there's my email and contact information. So again, thank you so very much for the opportunity to meet with your group and chat for a few moments this morning. I greatly appreciate it.
Gina, thank you. We appreciate getting that information. It looks like that's a great product that you've done. I feel like our mini grant money has been well spent. It did remind me that if you are on the Mountains of Hope listserv, Lauren recently sent out information for people who are wanting to do certified tobacco cessation specialist training. There are some scholarships available for that are happening this fall. So that's a good follow-up for anyone that would like to get in on that.
Yeah.
If you apply, make sure you check the box at the bottom that you're an MOH member so we can give you one of our scholarships.
Yeah. Thank you all.
Okay, so from Linwood Alive, this will be our final mini grant presentation today.
Good morning, everyone. My name is Tracy Valash, and I work for WVU Extension through the Family Nutrition Program. And I am here with Terry White, who is the head of our Linwood Alive community organization. So Terry, if you want to say hi real quick.
Hello, everybody. Thanks for having us.
So just real quick, if on the Rethink Your Drink, it's one of my absolute favorite programs. We do a lot with it in the F&P program. If any of you are wanting to do Rethink Your Drink or outreach in your counties, reach out to your county extension. I'm going to share this little guy real quick. This is Quench. He is our mascot. He can come visit your school. He can do Rethink Your Drink programming. So just a quick little plug for F&P. So Rethink Your Drink is such an awesome program. I'm so glad to hear that that's happening around. So I'm going to switch to my presentation screen now. All right, so Linwood is located at the base of Snowshoe Mountain Resort, and we were lucky enough to receive a grant to help increase physical activity in our community, and that is what our presentation is about. So the information on the left came from the 2019 West Virginia Cancer Burden Report relating directly to obesity-related cancers, and this is the information that we use to really open up our community's eyes about the importance of obesity. As you can see on the right, these are Pocahontas County's statistics. These are from the cardiac study. Some of you may be familiar with the West Virginia Cardiac Project. Our health educators, including myself, helped to collect the data. This is from last year here in Pocahontas County. We have these for about 20 different counties across the state, and I'm happy to share them with you all. It shows that in Pocahontas County, we are either have higher obesity rates, especially in kindergarten, and then through 2nd and 5th grade, how high our obesity and overweight in our children is. So in Linwood, we have a huge focus on children. We kind of feel like getting them started on the right foot forward will help make them successful later in life. And bikes are really our passion here, as well as just being outdoors in general. The Linwood Community Daycare, Terry and I had the pleasure of starting about 7 years ago. And from the very beginning, physical activity, nutrition, and obesity prevention have been at the forefront of our little community. And on the left, you can see the little bike riders. We got the Striders back in 2013. And the picture on the right was actually from this summer from our annual Strider Cup, where we have kids that basically from walking all the way through older kids participate, get their heart rates up, and it's an awesome community event. So when we were trying to think about, you know, the next step for our community, the biking really kept kind of coming up and something that we wanted to focus on. So with the help of Mountains of Hope and the Snowshoe Bike Park and our local trail organization, Polka Trails, we took our $3,000 mini grant and we bought a bunch of dirt. So the dirt was actually donated by Snowshoe, and we had to use the funds to get it there and the different signage and elements that came with building the track. If you're familiar with our area, we do have a lot of mountain biking opportunities, but not really any of them are geared towards beginners or young children. And this track, as you'll see in a second, it really attracts all ages, all abilities. And the best part is that the physical activity can be anything from moderate to vigorous. And it happens really quickly because you're constantly pushing. These photos are from our Wednesday pedal powwows. We've done 3, and now with the snow, we'll probably have to wait till spring to bring them back. But what we built with the soil was a series of like berms and jumps. And as you can see, we've got a little one, she's maybe 2, it's on a bike and she's enjoying herself. And then we've got big kids and adults. Our Wednesday events have had anywhere from 17 to 20-ish kids participating, ages 2 to 12. And as you can see in the right-hand corner, lots of spectators and just a general community surrounded the event. And we're hoping to do more things like this to encourage other people to get on their bikes and be physically active. Like I had said before, it can be for little kids. This image was actually, we had a visitor to the track. This is the world pump track champion, was actually at Snowshoe riding, and he came down and checked out our little pump track at the bottom and really made it look quite fabulous. And I have a quick video. He makes it look really good. And so he's actually balancing on his rear wheel and doing it. When the little kids do it, they just kind of, you know, roll over it. But Tommy, this is in slow-mo. Tommy just makes it look easy. And it's a full body workout where they're pumping their arms and legs and kind of zipping around the course. And this isn't the end. You can see the pump track is just a small piece of what we're hoping to expand. Snowshoe Mountain has agreed to let us expand our community footprint. Right now, it only includes basically our farmers market pavilion there, which we built a few years ago, and like the kind of direct surrounding area. And we hope to build about a mile or a half mile of a loop where there'll be different physical activities throughout the path. So it's kind of a choose your own adventure where little Johnny on a Strider can do the whole loop and have fun, or maybe an older student or child might be picking some wooden features like this one on the left, or a rock garden, or going over a teeter-totter. It really brings biking to everyone in our community. With as much beautiful single track as we have, it's just not as approachable to beginners and to young children. So we're hoping to get more people in our community physically active and adding to our already established healthy initiatives like our farmers market, our healthy cooking classes, and so forth. So we're hoping that we'll get the funds to continue to expand and have more opportunities to get more of our community physically active for obesity prevention and cancer prevention.
Wow, Tracy, that is amazing. I got my cardiac rate up just watching it. I think it's because I'm so proud of all of our mini
red
grants.
faces. All the kids are riding around and their faces are just beet red from being so physically active. And it happened so quickly. And that's why we are excited to have the trail expansion so that they can do some, high intensity on the pump track and then, kind of slow it down and then bring it back. The pump track also gets crowded. Nice to be able to kind of expand that area and give kids and families more opportunities.
That is absolutely fantastic. So this is definitely one of those reasons we wanted to get everybody together in November so that we could see the projects that people are doing out in the community and really have a chance to talk to you about that. I am feeling the need to add some time so that we can be more engaged in the future. But right now we do want to give everyone a chance to get into our work groups and talk about the work that we're doing in our subcommittee work groups. I will say work group leads, we won't do a...
Let's see. There we go. Okay. My name is Dan Kimble. I am the Director for Access to Justice in West Virginia. And we just wanted to, I wanted to walk you through a general explanation, basically so you understand my role. I'm the old guy who was there one time and remember fondly my days in the legislature. The two real sharpshooters on this whole experience are my two friends who are going to follow me. They are to this day currently engaged in lobbying efforts and representations. And trust me, that's where the wealth of knowledge will come. I wanted to put up, as you can see in the first slide, the top 10 thingies of lobbying. That title, as beautiful as it is, actually comes from having spent the last 3 days doing 9-hour-a-day Zoom conversations. And so 27 hours of Zoom in the last 3 days. And last evening, I was putting this slide together. And I started with the top 10 do's and don'ts of lobbying. And my wife accurately pointed out, you don't actually use the word do or don't in any one of the 10 explanations. And I'm like, yeah, it's really not do's and don'ts. And after 27 hours of Zoom, I could not put a word there, but thingy. So these are the top 10 thingies on lobbying. And if you don't already have a high anxiety level because of COVID, maybe this will lead you there. So number 10 is learn the rules of the game. As you possibly prepare to go to Charleston or to even engage by telephone with our legislators, one of the things that I really can't encourage enough is for people to get a sense of the process. You have to understand. For instance, bills have to be introduced by a particular day in either the House or the Senate. Usually that's somewhere around day 40 to day 44, right? It varies at times in the schedule. And then they have to be out of that chamber by the 50th day. So, over the years, I talked to somebody and they're like, it's day 55. They've got a Senate bill that's still in the Senate, and they're talking to me like they believe their bill is still alive. And it's like, no, it really isn't, because you didn't understand the rules of the game enough to keep it moving. So, just concepts of that. What does it mean when it says a bill is double referenced or the deadly triple reference? And what that means is on a triple reference is that thing's going to go through 3 committees, and oftentimes that procedure is used to slow things down, to slow the process down. And I would say it's more a rare occasion that a bill on with triple references ever actually make it to either the House or the Senate floor. I wish I could go through all of these rules with you, but the reality is, as I said a little bit ago, it'd be like trying to explain the Old Testament in about 10 minutes time. There are too many to give you that process. What I want to give you is the encouragement of taking the time and understanding it so that when you are there, you can speak with wisdom to the people in front of you, because that will matter. If they sense that you really don't have a grasp of the process, then they begin to spin you a bit. And you need to take the upper hand and make sure that you can impress upon them that you know what bill referencing is, that you understand the process that you're engaged in. Again, that's number 10. Number 9, equally important, is know the players and their positions. Let me give you 2 quick examples that often occur here among inexperienced people doing lobbying. And one of them is they're talking to the chairman of Roads and Transportation. Now, they're really impressed that they found a chairperson to talk to. So they're talking about to the chairman of Roads and Transportation about a bill involving financing of a hospital, when in fact they should be spending their time talking to the finance chair of both the House and the Senate. So just grabbing someone with a title, well, most every one of them that make it to Charleston are given some form of title. Just finding somebody with a title to talk to is not necessarily achieving your goal. You need to find the people that are connected to the issue you're dealing with and to focus on them, to know who they are, to know where they're from. These are all, again, obviously all people from West Virginia, so they take their home area rather serious, and it's just a nice way to begin conversation with them, to ask them something about where they live, where they come from, and if you can, one of the more powerful things is to find someone who is part of your group from their area. Because they're often they're far more responsive to individuals that also can influence the electorate from which they come. So knowing the players and their positions. The other example on that one I would just real quickly provide for you is, and this switches, so I don't want to. This is about as political as I'll get, but I'll just say this. If you tell me, using the current legislature, if you tell me that you have 2 freshmen or newly elected Democratic delegates that are sponsoring your bill, my mind is already processing, oh, so then you have really no hope for its passage this year, okay? You've got to recognize the chambers as they exist. And, in my time there, if you'd have had two Democrats on the bill, there were good odds your bill would probably move forward. And nowadays you need 2 or more Republicans on your bill the majority party, to go back to one of those rules, the majority party controls the process. So they get to decide what bills get put on the agenda, so forth. And while I encourage you, we always try to encourage people to make their bills as bipartisan as they could. If you can do that, get people from both parties, show that there's support across the board. But but in the present circumstance, you need to know where the power lies and who controls the mechanisms. Number 8, and I only put this there to reemphasize this: have a plan and work the plan. And here in a little bit, Megan is gonna take this and go with a little further than I intend to in this real quick countdown. But I can't emphasize enough what she'll be sharing with you and the knowledge that effective lobbying does not occur by just finding a parking place to Capitol and randomly going in and trying to decide who you might get an appointment with that day. The people who are really effective at these efforts, whether they are professional or whether they're just citizen-based, always enter the building with a plan, usually have their appointments set up. As I said, Megan will explain a lot more of this, but have a plan, work the plan. Number 7, nothing is on time but you. We basically refer to it in the building as legislative time. So the common question was often asked me, does anybody know what time the 9 o'clock session starts? And at that point, it might be 10:30, 10:45. The schedule there varies because of the work of committees. So do not be surprised if you have a 1 o'clock appointment with a senator that they may come in at 1:15 or 1:20 because they didn't get out of a previous meeting. The problem is you can't assume that for yourself. So you'll see the people doing, particularly the professional lobbyists. You'll see like Travis and Megan. You'll see them actually already sitting in the hallways outside the chairperson's door or the member's door, just in hopes of catching them in time for their appointment or whatever. So you've really got to put yourself in that mindset that it may be frustrating, but it's truly how it works. Number 6, keep it brief. If you get in a room with them, give them one piece of paper with your goals and they refer to them as white papers, but your sense of what it is you're seeking to do. The moment you make it 2 pieces of paper, you've probably eliminated about 3/4 of them from ever reading any of it. And certainly, if you hand them a whole folder, they'll hand it off to someone like me and never probably take a glance at it. And in fairness, people use this to make fun of the legislature, but in fairness, they're being bombarded with all kinds of material. And they, every time, people don't think about this, but every time they go to move, to walk to their vehicle, to walk across to the other chamber, the House or Senate chamber, people in the hallway are handing them stuff, telling them stuff. And so it, for the sanctity of their time, place in their hands things that are brief. If you get an appointment with them, be direct and to the point. Ask them if they have any questions, but be aware that probably whatever is really important to you is only one of 200 things that are important to them, and they don't have. Typically, they have maybe 5 to 10 minutes at best to hear you out and to express any questions or thoughts. Number 5, I particularly appreciated my picture I found here. Number 5, learn to take yes for an answer. Probably one of the more deadly sins that I saw when I worked in Charleston was people would go into a room, they would explain to the delegate what they hoped to have them support, and they would say, delegate would be like, sure, I can be on board with that. Well, the person felt like then that they just got momentum. They just got reinforced. So now they're really going to take off, and they're going to explain that much more to the delegate about why it's a good idea, even though the delegate has already said yes, already offered their support. And as they taught us in law school, when a judge indicates that he's going to rule in your favor, shut up, be quiet, stop, let them rule. Don't keep talking till you talk them out of what you had previously gotten their commitment on. The same thing with delegates and lobbying. Listen, if they tell you they've got your support, thank you, leave them with that one paper and figure out who else it is you need to move on and to speak with, or to ask them, is there anyone you would encourage me also to go talk to? Learn to take yes for an answer. Number 4, always remember when you're down there that it's not over till it's over. And the best way I can share this bit of information is through a story that occurred from a professional lobbyist, by the way. She had a bill. It was the last evening of the legislature, the 60th day, and she decided things looked really good for smooth sailing and called it a day and went on home mid-afternoon. That evening, there was an amendment from a person who was in essence trying to tank the bill. And strangely enough, it gained momentum. So the amendment passed, which then made her bill almost totally the opposite of what she wished to do. And my boss, the Speaker of the House, so as not to embarrass her with a law that she didn't really want, pulled the bill from the agenda and wouldn't let it progress any further. She shows up at the Speaker's office at about 11 o'clock, and the only thing she knows now, because she's been gone for about 7 hours, is that the Speaker has pulled the bill from her agenda, or from the agenda, and she levels him in front of everyone. I think probably in truth, what she was most frustrated about is she knew better than to leave before it was over. And she sort of forgot that principle. And she left, and instead of keeping people from manipulating the bill, it happened. So to you all who obviously won't be in the professional lobbying role, but individually, don't claim victory just because a bill got out of the House of Delegates. It's also got to pass the Senate. Don't claim victory until it's signed by the governor. It's these things. Anything can change, can be altered. A lot of times, the governor's office will veto a bill simply on what's called technical error, which means you might have substantively did all of the right things upstairs, but because of some error in the way it was put together, it still goes down to defeat. Number 3, good ideas fail, don't burn bridges. And Travis and I were actually just talking about this very scenario yesterday, in that sometimes when I came back to Morgantown and worked for the Chamber of Commerce, very experienced career attorney said to me rather innocently one day, I just don't understand what the problem is. This is a really good idea. Why doesn't the legislature just pass it? And I shared with him that every year there's a lot of good ideas that fail. They just don't get the momentum. I think the concept is typically that it takes a bill about 3 to 4 years of people becoming familiar with it before it passes the legislative process. So in those early years, you may be totally committed to your idea. You may be wed to just how kind and compassionate your idea is. There's still probably better likelihood that it will not make it all the way through the process on its first attempt. Now, when that happens, you've got a couple of choices. You can professionally sit down and write thank you notes to those who supported you and reach out to those who didn't and ask them, if there's any way that you could help alleviate some of their concerns or address their issues. Or you can walk into their office and just blow up on them. And just totally go unhinged. I would say to you, there's really good odds next year they're not going to let you in their office at all. So, and we see that. We see people who are so wed to what they're working on that when it goes down to defeat, they come at it with a great sense of passion. And it usually only hurts the cause in the long run. Number 2, be honest and be accurate. I can't emphasize this enough. We emphasize this to all of our attorneys that practiced in the House of Delegates. And I certainly would emphasize it to lobbyists. If you're meeting with delegates and they ask you, do you know of any opposition to this bill or any problems? The question I used to always ask was, who else is going to show up in my office next and tell me the complete opposite of what you're telling me? Be honest with them about those concerns because it's going to happen. The legislative process is typically so slow. It's designed to be that way so that the parties that are interested, the stakeholders, will reach out to them. It's better if you help shape the counter argument to that, to say to them, oh yeah, now you're going to hear from this group of physicians that might say to you, this is not necessary. But here's why I think you need to understand that it is. And begin to make your argument there. Be honest with them about what opposition they may face, what what numbers you're getting, and be accurate. If they ask you a question and it's a numeric question and you think the answer's 10, but you're not really sure, say to them, you know what, let me get back to my office and get that information for you. Who can I send it to? How can I best get that to you? Here's the danger, and this happens every once in a while. You sort of think you know, and you wing it, and you give them a bit of information. And the next thing you know, quite unbeknownst to you, either in a committee or out on the floor of the House or Senate, they're quoting your information as a realistic statistic. And then someone stands up across the chamber and provides them the real information. Now they've got egg all over their face, and the person they're going to remember is the person who told them this information. And once you lose your credibility, your effectiveness is also gone as well. So be honest with them, be accurate with them. Do not, and again, this is the line we told our attorneys all the time, do not hesitate to say to them, I do not know the answer to that, but I'll be more than happy to get the answer and get it to you. It's better than winging it. And the last one of my little general tidbits of information is beware, it's addictive. You'll hear from Megan and you'll hear from Travis. It pulls you in. It pulls you in. You'll go down for your issue or issues, and all of a sudden you'll hear of other things occurring in the building, and it just has a way of drawing you in. And I'll share this final example on that front. I've been gone now since 2013. I moved back to Morgantown in 2013, so 7 going on 8 years. Still on most evenings of the legislature or afternoons, my wife will tell you that I'm carrying an iPad, walking around our home, screaming at my iPad as though it's a football game, as though it's something, going on, but I'm yelling at the iPad over somebody's speech or somebody's doing something. Even when you no longer work there or engaged there, you somehow just can't seem to let it go. And so I thought addiction really might be the best use of what occurs there. I want to take a moment at this point and introduce a little more to say. Megan Roskovensky is next on our agenda to speak. I got the privilege of working with Megan in the House of Delegates. There was a humorous scenario. They all referred to Megan as my favorite. I was the chief of staff and Megan was my favorite. And one day I thought about that and I thought, you know what, I'm not even going to resist arguing that. She is a graduate of WVU in public administration. She is brilliant. She came up through the legislative process, but now is out doing healthcare lobbying. Megan is one of those people who is typically thinking about 18 steps down the road in the process, and those people are always appreciated when you're down there. So, Megan Roskovensky, my favorite, if you will.
Thank you, Dan. It's still a title that I hold proudly. It's on my resume, frankly. Dan's favorite. Hi, everybody. Thank you so much for allowing me the opportunity to speak to you this afternoon. I'm so excited. I asked Dan, can we just have a conversation? Are you gonna do a PowerPoint? I have a PowerPoint. I wish we could be a little bit less formal, but we probably need to go through this just so I can keep on track. Do you guys see my PowerPoint up there now? Because I do not. It's Advocacy 101. You see it? Okay. Yes. And there are other awesome people on this webinar today who know just as much, if not more, than I am. Juliana, I see her on there. She's a great friend and a wonderful advocate for the Cancer Society, and obviously Travis and Dan, and anybody else. Just jump in. I'm totally casual. If you have any question, or if I missed something or whatever, just give me a yell and stop me and say, Megan, you've lost your mind, because it's highly possible. I'm trying to, give me 1 second, gang. You'd think I'd have zoomed down now. I want it over on my other screen. It's not working. Okay. Well, Advocacy 101. I like to call it advocacy and not lobbying, just because it makes it sound better. Whenever I tell people I'm a lobbyist, I'm like, oh. And advocacy, I think, is a little bit a little easier to swallow, and also, actually, especially for you guys, is a little better descriptor for what it is you're going to be doing. You want to be, you're an educator, you're and an advocate, and I think that role is super important. That's my understanding. You guys don't just want to pass legislation, but you want to be a resource as well. So what I'm going to go through is kind of a to-do list for you guys for the next handful of months to help bolster that role for you, both as a resource and as an advocate for cancer issues in the state. Number one, February 10th is the first day of session. Session starts a month later this year because it was an election year. If we had a change of governor, that would have given our new governor a chance to form his legislative agenda and budget. Obviously, we have the same governor, but still, February 10th will be the first day of session. So we have a little bit extra time this year, which is good. So, oh, my COVID disclaimer. Everything that we're going to talk about, I'm kind of considering what the changes that might happen during session, but what I say could totally be thrown out the window depending on what rules the legislature puts in place regarding entrance to the Capitol, meetings, that type of thing. So this is given with my best guess as to what's going to happen. This is kind of the route that I think you should go, and I'll go into more details towards the end about the rumor mill and what we kind of think session is going to look like. But let's dive into my to-do list for you because we need to hit the ground running, get started right away. Here it is. In kind of a roundabout way. That's what your timeline's looking like between now and the end of session. And I'm going to go through each of these things, obviously. But the big one that I want you guys to do yesterday is congrats letters. A congrats letter needs sent to every single elected delegate and senator, introducing yourselves, putting yourselves out there as a resource. Explain who you are. Explain the types of information that you can provide. I never get into my legislative issues in my congrats letter. I just use it as an introduction, as an explanation of who I am, the program, or the client that I represent, that type of thing. I would not, don't get into the weeds on your legislative asks. Just stick to introducing yourselves as a coalition and what services you can provide to them that would be of assistance. Second, you need to start, if you have not already, you need to start now talking about your wish list for session. I would not do any more than 3 initiatives, bills, essentially. And even then, you're going to have to pare that down. So think about what your top 3 issues are, the top 3 things that you want to get past. One of those is going to get legs. Maybe if things go according to plan, you're going to have to be flexible on what that is. But make sure you know what you want those 3 pieces of legislation to be. Identify champions. Who that's in Dan referenced this and know the players. If it's a healthcare bill, who do you need to go to and say, hey, this is our issue. We really need support on this, and educate them and sell them on your idea. If you need money, you're going to go to the finance chair and do the same kind of thing. I actually already did this for you guys. Here are your champions. in the House of Delegates and in the Senate, regardless if it's a healthcare issue or a finance issue, these are the people that you want to go to and ask for bill sponsorship.
Did I mention, by the way, that she's my favorite? Anyhow, did I say that?
Write these names down. These are the people that you want to schedule meetings with.
Megan, can I just say that this was one of the most asked questions as far as like pre-registration This was one of the most asked questions that we got, so kudos.
There you go. Good. I'm glad I can be of assistance. But these either have healthcare backgrounds, are involved in the health committee, or are on the finance committee, and a lot of them overlap. So like Jeff Pack is the health chair, but he's also on finance. Tom Takubo is lots of physicians on this list, as you will see. Mike Maroney is the health chair, and he's also on finance. So you're gonna get the most bang for your buck with the people on this list. So if you can only meet with 10 people, you need to get everybody on this list on your schedule. So I'll obviously send you guys this PowerPoint. You don't have to take notes right now, but these are your go-tos for introducing legislation and getting them total buy-in on your legislative initiatives. And as Dan said, you got to know who your opposition is. I don't know that. Might there be a hospital out there that won't like what you guys are trying to sell, or a cancer center that's not on board, not a member of your coalition, and might not be on board with doing something that would assist you all as opposed to them. You guys are going to have to determine that. Except I do know if you're asking for money, your opposition is going to be anybody else who wants that money. So you guys have to come to the table and say with a good reason why you deserve that money over somebody else. So as far as, like I said, for the most part, you guys are going to have to make those determinations, but you absolutely have to know, just as much as you have to know the people that are on your side, you have to know the people that aren't, and how to address anything that they're going to say in opposition to you. Have a rebuttal ready to go right from the start. I put this on here, my little shooting star. I remember when I graduated from high school, I got this little framed plaque that said, "Reach for the moon, even if you miss, you'll land among the stars." And I think about that every time we go into drafting a bill. Reach for the moon, even if you miss, you'll land you'll land among the stars, which means in your initial draft, put absolutely everything that you want. It's your great wish list of, in a perfect world, this is what we want this legislation to look like. And then know that you're not going to get it. You're going to have to negotiate, and you're going to have to be willing to know what your happy medium is. What are you willing to take out of that to still make it a bill that you guys are happy with? So, and that's why I always call it your happy medium. Here's your perfect world, but know what your happy medium is from the get-go, what you're willing to accept, and be happy if you get to that happy medium. Develop handouts. This is something that you want to do before you have your meetings with anybody. And this is, Dan alluded to this as well. 1 page only. Nobody is going to look at any more than 1 page. Stick to pictures, graphs, and bullet points. If you can get your point across in a graphic instead of asking someone to read a paragraph, that's going to go much farther. I don't do any prose if I can possibly avoid it. You know, I might do a little 2-sentence introduction at the top of the page, and then maps, charts, anything like that that can get your point across that doesn't require a lot of reading is going to be way more effective. And obviously include your contact information. So after they look at that, after you have your meeting, you go over the handout, they know how to get a hold of you. Put your cell phone on there. Lots of people don't like giving out their cell phone numbers, but I think it's a key to communicating And it's especially going to be key to communicating during COVID, because we might not be able to get in the building. We might have to communicate via mobile devices and Zoom and that type of thing. Okay, so sooner rather than later, I want you guys to set up meetings with those people on the list that I gave you. Obviously, they should be Zoom meetings at this point, but I want you to get people on your side ASAP. As Dan said, even outside of legislative session, this is definitely the case during session, but even anytime, you know, a lot of these guys are physicians. Schedule your meetings, but be flexible. Don't panic if it's 15 minutes and they haven't shown up yet. Just hang tight and be as flexible as you possibly can in getting these meetings scheduled, and waiting around if they don't happen when you necessarily think they're going to happen. As Dan said, you'll maybe get 10 minutes on a good day. So you have to really get your script down on what you want to say, the key points that you want to hit, and be concise in delivering your message. This is something that I do: assign topics and rehearse. Say you're going to have 3 people involved from your side in this meeting. I would figure out going in who's going to talk about the financial aspect, who's going to talk about the healthcare aspect, who's going to talk about the impact it would have on that legislator's community, and figure that out ahead of time and rehearse it if you have to. But you don't all want to go in there talking on top of each other, saying the same thing over and over again. It's really important to have a script, stick to it, and make sure, and that just helps to make sure you get all your points out in a timely fashion. And you know, it gives them a chance to talk to everybody. If you go in and just have one person as your spokesperson, I don't think it's nearly as effective. So I would definitely rehearse, plan what you're going to say ahead of time before you get into a meeting with any of these individuals. Give them the handout. When you have your meeting, make sure you have the handout. If you're doing it electronically, make sure you have it on hand to email them. And you also want to have a hard copy and an electronic copy of the bill. They're going to want something in hand, probably to read. But if it's a bill that they're going to be willing to introduce, they need an electronic copy as well to send down to bill drafting. So you want to make sure you have both available. If it's a Zoom meeting, obviously all this stuff is just going to be electronic. If you're in person, you want to have hard copy of the handouts and the bill to give them. And at the conclusion of your meeting, you need to ask if they're going to be willing to sponsor the bill. If you can get them to commit before the meeting is over. They might say, you know, I'm going to have to take a look at this. Let me get back to you. If that's the case, follow up. Don't forget, you got to keep after them. You got to get that commitment to get them to sponsor. So don't just think that if they say, let me take a look at it and I'll get back to you, don't think they're going to get back to you. You need to follow up and get the commitment of sponsorship. I'm going to defer to Travis on this a little bit. I'm not sure how WVU handles it, if they have somebody that drafts bills for you guys. And you know, if there's a process that you all go through to get bills approved by the university before they can go through the introduction process. He knows about that a little bit, you know, obviously more than I do about the logistics of that. But what I am going to say is, if you can have your bill drafted the way that you want it, instead of having somebody in the legislature draft it for you, you're in better shape. there is a group at the Capitol called Bill Drafting. Literally, that's the name of the office. And a lot of times legislators will call down to them with concepts and say, hey, this is kind of what I want it to look like. And that's great, except it might not necessarily look like what you want it to look like. So if you can actually, you need to have that bill in hand when you go into these meetings. So there's nobody at the legislature kind of taking your idea and running with it. You need it concrete. This is what I want. So again, Travis might have be able to share with you all how that actually happens for you guys. But yeah, I wouldn't rely on legislative staff to necessarily. I don't, even though my husband is one, I'm too possessive to say, yeah, go ahead and figure that out for me. No, I want total control of what that bill looks like before it gets introduced. Okay, so this is kind of, that's your leading up to. That's everything that's going to be done between now and the end of January. This is once session starts. Hopefully you already have your sponsors in place, and the bill will be introduced relatively early. If you don't have your sponsors in place yet, don't panic. I have done it the first couple weeks of session plenty of times, and it's still fine. But I like to have that groundwork laid before session starts, if at all possible. And I think it might be easier this year because of COVID, because you can do the Zoom meetings and that type of thing. I think you might be able to interact with people sooner than you necessarily. You don't have to wait for them to get to Charleston, essentially. So as Dan said, know the rules. Understand that bills are assigned to committees. And then once those bills are assigned to the committees, focus on those committees. If it goes to health and finance, try to connect to every single member of that committee, at least every single Republican member. I'll get a little bit more political than Dan will. Reach out to the chair of the committee. Ask him to please put your bill on the agenda to make sure it gets on there. If you have Jeff Pack, who's the health chair, as your sponsor, it's much more likely to see the light of day of an agenda. Hit the vice chair. Make sure you have the support of that committee before it's on the agenda. You don't want a bill to go down actually in committee. You don't want it to be voted down. So do your work to reach out to every single member of the committee where the bill has been referenced. Once it gets through health, switch gears, hit finance members hard. Hit the chair, make sure it gets on the agenda, ask over and over and over again until it gets on an agenda. Squeaky wheel does get the oil at the state legislature. There is a fine line between being effective and being a pest, but don't let it go. Don't think just because somebody says, yeah, I'll put that on an agenda. Follow up until you see it on an agenda. During the committee process, I never talk to anybody who isn't on one of those committees. Don't waste your time on people who aren't on those committees. Just make sure you get all those committee members on board, and everything else will fall into place. If a bill does make it onto the floor, that's when I'll make sure everyone gets my handout. I'll make sure my bill sponsors, the chairs of the committee, are prepared to discuss that bill on the floor. Should there be any questions, I'll prep them with all my talking points and that type of thing. Give them a handout again. Don't think that they still have it from the first time that you gave it to them. You can even develop some talking points, some bullet points that they can use when they're on the floor to defend your position. But still, they're kind of sheep in a way, if they see their leaders, if they see the Speaker of the House and the chairs of the two committees that the bill went through are supportive, most are going to vote yes. You don't have to talk to all 134 members. And I know none of you guys aren't in Charleston, you're not full-time lobbyists, you're just not going to be able to. So you just got to focus on those core individuals that we've already talked about. You get them on board, everyone else is going to fall in place. The exception to that is, as Dan kind of mentioned this earlier, if somebody's on Facebook bashing your bill, or there's somebody that you know is going to stand up on the floor and say, this is a terrible bill and here's why, I would absolutely reach out to them. They might just be misinformed. I would reach out to them and say, as politely as possible, as Dan mentioned, are there any concerns? I understand that you have concerns with this legislation. Is there anything that I can help address? And it might be that they're just, love cancer and want to see as many people with cancer as possible, and there's nothing that you can do. But a lot of times, misconceptions can be cleared up with a simple conversation. So I think it is in those circumstances worth reaching out and saying, hey, what can I do to make you feel a little bit better about this? And as Dan said, absolutely don't give up. I, for the record, was not the person who left 7 hours early on the last day of session. Who was that? I have gotten bills passed at 11:45 when session closes. The end of the legislative session is at midnight. You can't, things happen. You can't just assume because it doesn't get on an agenda when you think it's going to, that it's dead. You gotta keep after it, keep after it. And never, ever, ever give up until it's dead for sure, because there's always a chance. So I think that's a lesson that not everyone, they get discouraged too quickly, too easily. But keep at it. Okay, and these are my big reminders. As Dan mentioned, the legislative process is designed to kill bills, not pass them. It's to vet all the bad stuff that's out there and make sure it doesn't get through. Only 10% of the bills that are introduced typically actually pass. So don't get discouraged. Again, as Dan said, I was a little bit more generous. I said most bills take at least 2 years to pass. He might be correct that it's more like 3 or 4 years. But every year that it doesn't pass, you have gained a year of education where you're teaching members about who you are, what your issues are, what your needs are. So it's not time wasted. Don't ever think of it as being time wasted if you have legislation that does not pass. You made progress during that session. And also advocacy is year round. Don't think that you can just focus on the 60 days the legislature is in session and be successful. Send them birthday cards. If you see something in the newspaper where somebody was recognized, cut it out and send it to them and say, hey, we saw this. If there's a positive story in the newspaper about you guys, email it to them, send it to them. Keep that communication open throughout the year. If you guys are having an event, invite them to it. Lobbying is all about relationships, and you're going to have relationship building takes time, but it's also, again, year round. It's not just a 60-day session. Maintain that communication as much as you can throughout the year. This is where I said that I'm going to get a little bit more political than Dan is. I'm just going to slap you in the face with it. There is a Republican supermajority in both houses. Don't think Barbara Fleischauer's name on a bill is going to help you. It's going to hurt you. I love Barbara. I hate to say it. Don't get her to sponsor your bills. Mike Pushkin, Danielle Walker. They're not going to help you get a bill passed. It's going to keep a bill from getting on an agenda. So there, I said it. I wasn't sure if, I hate to be that blatant about it, but it's true. There are certain people who their support is going to spell the death of your bill. Focus on the people that I gave you the list of earlier on. And that they are the key to your success. Oh, do I have things that I haven't been talking about, or like questions? I'm sorry, just something popped up. Chat, guys. Okay, I forgot to look at questions. Should I do that now, or should we let Travis go? I think I'm done.
Let me, Megan, if I can, you look down through that and see, but I'm going to jump on over to Travis because I know we're pushing time limits.
I know, I talked too long.
No, though. I appreciate your word. By the way, that last statement she made there, that quiet, passive side of her was always one of the struggles I had to deal with when we were.
It didn't cuss though, Dan.
No. If Megan was my favorite, Travis is my son. Travis Mollohan worked actually with my wife in Governor Manchin's office for a number of years. Travis went on to work in the U.S. Senate offices with Governor Manchin. He is a graduate of WVU in political science. And eventually, probably in what was like my wife's happiest day since we came back to Morgantown, we were all able to convince Travis to come back to Morgantown, where he presently serves on the team that does government relations for the university. Travis is the male version of Megan in that he can give you every statistic going back any number of years on whatever project he's working on. And he's both brilliant and kind. And so Travis, if you'll take over.
Well, thank you, Dan. Like Dan said, we've known each other for a long time. Dan's like a second father to me. So I always go to him for guidance on anything, whether it's a personal matter or a political matter. And I know Megan does the same, and it's always good to be with Megan outside of the West Virginia Capitol, and my good friend Juliana, who I'll talk a little bit about today because Juliana and I experienced a bill where we had to make major concessions on and compromise just this past session in order to get it passed, but we'll talk about that in just a little bit. So, as Dan mentioned, I do government relations for the university. I'll talk a little bit today about that role and how some of our practices I think can help you all, but also how our Office of Government Relations, while it represents generally the university and the administration, is here to help you in facilitating meetings, in potentially drafting legislation or finding folks to help you draft legislation, but also to help you understand the opportunities and the challenges when you meet with legislators who, Megan gave you a great list already, but who you may also want to consider talking to and using us as that gateway to them, because we work year round on meeting with them, on showing them the value of West Virginia University and getting to know them. So normally we can connect pretty quickly to a member of the legislature much faster than others. So we use us as a resource, use us as a guidepost for session in understanding what could happen in a committee and understanding what it means if your bill has been tabled for a day, understand what we might hear in the halls of the Capitol that will help you in getting your bill over the finish line. So I'll share my contact information with everyone later, but I'm here as a resource. We have a team that can assist you in a number of areas with your advocacy. And thank you to Megan for mentioning advocacy, because there is a big difference in my mind between lobbying and advocating, and us at the university consider ourselves advocates. I never specifically ask a member of the legislature to vote for something or against something. I believe that my goal is to educate them on the facts surrounding an issue and hope that they make the best decision that benefits the university. So since Dan opened the political gate and Megan walked through it, I'll talk a little bit about campus carry as a very specific example of that political nature of the legislature. So, you know, campus carry is one of those issues that has come up for a number of years, I think 4 or 5, and only in the past couple of years gained significant attention and almost passed. I think 3 years ago, it passed one house of the legislature. It almost passed one house of the legislature. A couple of years ago, it passed the House and went to the Senate, where it was defeated. It did not come up this previous year, but we expect it to come up in the future. So one of the things that we do, and again, I'm using campus carry as an example of our overall goal in working with our campus, with our community, and with legislators. The first thing you have to do is you have to work internally to understand what the campus view on an issue or what their goals are. So I'm constantly working with the staff council, with faculty senate, with our various colleges and departments at the university to understand what their goals are or desires are for legislative session. So working with you all, understanding what you might pursue this legislative session will give me an idea of how I can assist you, how your goals, to be frank, might run into my own goals of getting a bill passed. And also, again, to be your eyes and ears and understand what opposition exists out there that I can come to you and say, this member doesn't like this bill for this reason, you need to talk to them. This group is down there pushing against this bill. You need to have a plan to counter what they're doing, et cetera. Legislative session is sometimes a horse trade. Sometimes you have to be willing not only in your own bill to make concessions, but sometimes you might have to trade one bill for another. So you've got to understand all those different dynamics going into legislative session. And at the university, our portfolio is extensive. It's health policy, it's education, public education policy, higher education policy, social policy. We've been roped into a lot of social debates over the past few years because we're a cultural center of the state. We think that's important both for our community and for our campus and for the diverse body of students and faculty and staff that we have at the university. But all of those sometimes create barriers for us to get our work done, to get a bill passed or to stop a bill. So back to the point about campus carry, we knew that a number of our faculty, staff, and students didn't support the legislation. We didn't support the legislation, but we also had faculty and staff members who did support the legislation. So we tried to approach the bill from the standpoint that if it was going to pass, because there was a Republican majority, and as Megan said, there's now a super majority of Republicans that will likely support this bill. What framework can we get the bill in that it is the least intrusive in campus daily life, and it has some safeguards in place. You know, that's one of the things we have to do. We have to make those political decisions. We have to make those practical decisions that if something is going to pass that you don't like, you know, you need to understand what you can get into the bill, what compromises you can make to make it safer for your community, for your audience, et cetera. So, you know, I think that's just a little bit of a specific bill that we have had some difficulty on, and we know that coming up this session is going to be difficult as well. Megan really laid out some great pointers that you need to be advocating now. You need to be introducing yourselves now. I just actually finished earlier this week my congratulatory letters to the new members of the legislature and the returning members. Again, it's a letter from President Gee just congratulating them, looking forward to working with them. No agenda in that, just our contact information, the fact that we'll be on the ground if we can in these never-ending pandemic times, and we look forward to working with them. My next step will be in setting up Zoom sessions with certain members, with texting, making phone calls, et cetera, something I do all year around just to stay in touch. In fact, I was on with a couple members last night talking about something that our outdoor education program is working on with the Division of Tourism. So I'm constantly in contact with them if I can be, just to remind them that we're here to help, and we are looking forward to working with them. One of the good things about this legislative session is there are so many new members, so you have an opportunity to really get in front of them quickly and get them to understand the importance of your issue, and you may be one of the first groups reaching out to them. So I just wanted to share this statistic with you. I always look at these numbers, as I know that Dan and Juliana and Megan do too. There are going to be 7 new faces in the state Senate. Now, 5 of those are either senators who are returning or delegates who are moving up. But there are 2 brand new members who've never been in a legislative body before. So 7 new faces in the state Senate. In the House, 37 new faces in this upcoming legislative session. 33 are brand new members. As far as I know, never held elected office or only held county office or whatever. And then 4 returning delegates to the House. So right there off the bat, we have 44 new folks. 44 new folks, again, an opportunity to let them know what you're working on, what you think is important, and why you are asking for their support on a particular issue. So that's a good thing. That gives you, you know, a blank slate with many of these individuals to start. I always talk, when I meet with legislators, I always talk about the value of WVU. You can talk about the value of cancer research, of investing in a health policy that helps those affected by cancer. You know, you have to talk about the value so people understand, even if you're not asking for financial support, always talk about the value of it, because then a lot of these members think about return on investment. They think about the ROI. If we put $1 million in, what do we get out? And at WVU, we talk about that constantly. For every dollar that's put into West Virginia University, $4 is created in this state through economic opportunity, through tax spending, all of that. So that's a major return on investment for the state. And that's not counting our hospital system, which just amplifies return on investment in our state. One of the things that's important about talking to legislators early is making sure that you understand what their goals are. You want to know that because you want to get to know them. You want to try and build a personal relationship with them if possible. Now, like Megan said, you're only going to get a few minutes with them But the longer you're talking to them, the longer you're advocating for a number of different issues over a number of different years. This state is a small state. We all eventually end up knowing each other or finding out that we're related to each other. And that gives you the opportunity to really be seen as an ally to them, to educate them, etc. They will respect you even when they disagree with you, as long as you come into it, as Dan said, knowing the facts, being honest, being accurate, all of that. I think that that's one of the great things about this process is the personal relationships that you build, and get to shoot off a text to them, congratulating them on whatever, or having them, I have several members who, when I post a picture of my daughter, reply and say, hey, she looks great, she's growing up fast, all of that. That I think that's a special thing, and that's what people don't see when they look at politics usually. That we definitely don't usually see that when we look at federal politics, national politics in Washington, but that's happening every day in West Virginia, and I think that's a special thing, and I think you need to approach it from trying to understand them, understanding what they do for a living, understanding what district they represent, understanding their interests, their hobbies, etc. That's really important to getting to know how they might vote, how they might understand the issue that you're advocating for. I think that's really important to keep in mind. Internally at WVU, I want to say that no one is barred from lobbying or advocating. That's your constitutional right. Now, I think it's really important to understand that depending on the department or college or whatever that you work for, there may be specific guidelines that you'll need to make sure with your supervisor, with your office, that you're not stepping over. But we do not say to anyone at the university, please don't share your opinion with the legislature. We believe in freedom of expression. We believe in freedom of speech. We believe it's important for them to hear everyone's voices. We may have a difference of opinion on certain policies, but we always want to let our folks know that you are free and welcome to advocate to the legislature and to state policymakers. One of the things that is important for us, however, is to know that you're doing that. We would ask, as the government relations team, just to know. One of the things that happens to me on a daily basis in Charleston is, hey, I met with so-and-so faculty member, and they're working on this, and that's great, isn't it? And I have absolutely no idea that one, a faculty member was in Charleston, or two, that they were taking a specific action on an item. Now, some of that, again, is because legislators have a personal relationship with many of the folks at the university. That happens quite regularly with the delegates and senators that represent Mon County. Megan mentioned Delegate Fleischauer. She has a long history of working with individuals at the university, and sometimes she just reaches out to them directly. That's no fault of her, but I would ask, if you're advocating to a legislator, just let me know. Again, I'll provide my contact information, text me, email me, whatever. Again, I can help you understand the individual that you're talking to, or I can find out for you what you might want to say to that individual in order to get them to understand the importance of the issue.
Hey,
so,
Travis, I hate to interrupt
yes.
you, but I just have a quick question. So some of the folks on this call are not WVU employees, but they're
Yes.
still state employees. Can you speak to that a little bit?
I don't know. I think I would check with and Dan, you might know more a little bit about the state employee question. If individuals are, you should always check with your supervisor or your department or whatever. But I think you all are in a little bit of a different scenario because you're this cancer coalition and your advocates. Dan, do you want to speak to that just a little bit?
Yeah, just very quickly. In my time there, we would have numerous people from any number of state agencies, both on the behalf of the agency, and then at times on the behalf of themselves. So I don't know of a different policy restriction than what the university does, as far as, where they support people expressing themselves. I guess one of the things the one restriction that maybe does come to mind is you can't advocate or lobby on an issue, on a personal issue, while on the state clock. You can't go up to the Capitol and be paid your state salary to go around and address a personal issue. But I think Travis's other point is the thing I drive home, and that is always be certain you're communicating with your office to see if they have a particular internal policy that is different than the general open concept.
Yeah, you might have I'm sorry, someone's going to say something.
So Summer, I'm the facilitator for the coalition. And I wanted to ask a question because it kind of piggybacks off of that. So as a coalition, in my previous life, I'll provide a little bit of background. I worked at a state health department in a public health arena, and then I worked at the national level for a coalition. And they had a partnership where they would bring in the state people, do some policy work with them, and then those people would educate the legislators, and the coalition would make the ask and everything. But I don't know how that necessarily could work for us, because a lot of us are either WVU employees, so considered state due to our funding stream, or they actually are state employees. So is there anything that you can talk about that? Like, would it still be, we can do the education piece, but not make the ask, or just trying to get a feel?
Yeah, so I was just going to, based on Dan's comments as well, I was just going to say, there may be a particular issue that you have an opinion on. I think you need to, step back in those scenarios and understand that you might have to take annual leave, or you might have to let your supervisor know that, hey, I want to voice my opinion. A perfect example is campus carry. We had a number of individuals who, again, just wanted to voice their opinion, and we said, go for it, do whatever you want to. If you are specifically working through the Cancer Coalition and you're part of that network and you're advocating with the legislature, I think that's part of your portfolio as health professionals in educating individuals. Additionally, as university employees, I'm speaking to the ones as university employees, there are going to be times when, especially when it comes to the budget, we will activate as many employees, staff, faculty, students as we can if there are potential budget cuts, if there are programs that might be vetoed or pulled out of the budget. We will go all out on that, because we will want the legislature to understand that it is not a time to cut back funding for any institution of higher education in West Virginia. In fact, give us more money, we would say, because we can do a lot of good with that. So, I don't know that I specifically answered your question, but I think that if you follow the rules of advocacy, I think you're safe. I think Megan wants to jump in.
I just was going to add, Travis, because sometimes I have little pet projects that I work on that aren't necessarily related to my role in the Healthcare Association. So when I think it's really important to make that clear to a legislator at the start of your meeting, like, hey, I work for the Healthcare Association, but I'm wearing a different hat today. So you can go in and say, I'm working, I work at WVU, but I'm wearing my Cancer Coalition hat today, and I want to talk to you about issues specific to that. So I think that you do need to make it clear that you're not necessarily there as a representative of the university, but as a representative of the coalition. So I would just get that out when you walk through the door, and that will help ease some concerns.
And I would just jump in to say, in the course of this preparing for this, I had a conversation with someone who had indicated that they had heard that state employees were not to do lobbying. And again, your particular division, whatever, you may have a boss that's decided that's the rule for you all. The reality was, if we had a bill on election law, we were dependent on state employees from the Secretary of State's office to come up and inform us over what would work best. If we were dealing with child support enforcement or DHHR changes. So the reality is state employees are in that building all the time advocating on an issue related to their daily work. But I want to be clear, that's not me necessarily giving you permission that your boss maybe has individually restricted, but the general concept of state employees advocating, particularly if it's in the realm of what their job duty is happening every hour that the legislature is meeting.
Yeah. And I just wanted to add real quick, I know we're running over and you all may have more questions. One other thing that I think is important for everyone, any group, any agency, any individual, when lobbying or advocating to the legislature, is to always end the conversation with, how can I help you? How can, is there a particular issue we can provide more information on? Is there a particular issue related to healthcare or whatever topic you're addressing that you're interested in tackling, and can we help you understand that better? I always try to end my conversations with that, and again, I think that helps to build a pretty strong relationship with those individuals, because they know you're there to help them. And again, as Dan said, often I don't know the answer. I'm not an expert on every issue, but especially at WVU, we have experts who can provide economic analysis, who can provide ideas on healthcare, who can provide ideas on cybersecurity, et cetera. So, that's usually easy for me to say, okay, yeah, you want help on this, I'll find you someone to help on this. But yeah, that's always important in my mind. And just one more quick example. I know I mentioned I would talk about Juliana, but Juliana and I worked very closely with a small group on tobacco cessation legislation this past session. And we had a really great bill that was sponsored by Democrats and Republicans. And the way it passed the House, we were going to get money for tobacco cessation. We were really going to tackle this issue. It just wasn't going anywhere in the Senate. And so what we did is, instead of losing the momentum that we had with the bill, we just said, remove the funding mechanism and give us the commission so we can get this ball rolling, and we can come back to you and say, here's what this commission that you put together has said, here's what we need, work with us. That was a perfect example of, we had to compromise or we were going to lose everything. In some situations, you might want to just completely throw the bill out. In other situations, you might want to take what you can get and live to fight another day. That's a really important lesson that many people don't understand. In this hyper-partisan world we live in, everyone thinks, I'm going to get what I want, or I'm going to burn the world down. And it doesn't work that way. That's not how the system is designed, and it's not how we should be working as individuals in this process. It takes a long time sometimes for policy to be made, and it's sometimes really ugly. But oftentimes it's about knowing what you can win today and fight for tomorrow.
That is fantastic. Dan, Megan, Travis, thank you very much for that. informative session. I know that we'll be tapping you as a resource in the future. You're going to get tired of my face, I'm certain. And thank everyone that was able to stay on. There will be a recording available if you had to log off early. We'll try and get that to you. I think we're getting close to the end, but if anyone has any last minute questions, we'll take questions for about a minute more and before we log off.
We do have a post test and an evaluation of the meeting that we'll send out. Thank you, everybody.
Thank you.
Thank you.
Thank you.
Thank you, everybody.
Thanks.